Okay. Let's see. Share screen briefly.
Hello, Lisette.
Hi.
Oh, what happened? Oh, there we go.
All right. Welcome, everyone. Bienvenidos a todos. Today is going to be a call, right? The Parent Children's Leadership Training Institute of Solano will host. Special guest, we have Lisette Estrella-Henderson, Solano County Superintendent of the Schools, Dr. Bela, Matyas, Health Officer, Solano County. Bienvenidos a todos. Hoy en día, esta llamada va a ser presentada por Parent Children's Leadership Training Institute de Solano. Hoy en día vamos a tener como invitado especial Lisette Estrella-Henderson, Superintendente del Condado Solano, de escuelas son del Condado Solano. Y for your name now. My screen went out. Parece que se me cortó el internet. Okay. So with that said, I'd like to hand over the microphone to Alan for introduction of our meeting today. Quisiera ahora presentarles a Alan para introducirnos a la agenda de la reunión de hoy. Alan.
Thank you, Leo. Thanks for everybody participating on the Zoom meeting. We're really excited. Most of you who are on the call know about PLTI, that's the sponsoring agency. But let me just tell you briefly, we brought PLTI into Solano County 5 years ago. It's an evidence-based parent leadership program that gives parents the tools to be advocates for their children, for their community, for where they worship. As a result, we've had 60 graduates over 3 years, all doing amazing things. We have one who's on the school board in Fairfield Sassoon. We have others running for office in Vallejo. So we're absolutely excited. So talking about this topic about reopening schools is a policy issue that PLTI is thinks it's a really important issue. So that's why we tried to set this up, and we open it up to PLTI and other parents and community leaders. So thank you so much for being here. So what we're going to do is, I'm sorry.
If I may, let me just translate that briefly. Para toda nuestra audiencia habla hispana, habla en español, por favor, bienvenidos y gracias por estar presentes aquí. Un poquito de la historia de PLTI, Parent Leaders Training Institute. Es un instituto donde padres donde padres van por un programa de, creo que eran 12 semanas cuando fui en el 2016, y los padres aprendemos a jugar por nuestros niños, ¿verdad? Esa es la misión de PLTI. Obviamente PLTI aquí en el Condado Solano no ha tenido otros fondos para seguir esos entrenamientos. Hubieron 3 clases del 2016 o 2015 a 2017, recuerdo, en el que personas se graduaron y definitivamente estamos tratando de regresar el programa aquí al condado. Alan?
Thank you, Leo. Appreciate that. So it looks like we have somebody who just joined us. Would you mind saying who you are?
I'm going to assume it's me.
Talking about Monica?
No, I'm sorry.
Are you talking about Monica? Or?
No, somebody new. Under Galaxy? Maybe it was Monica. Okay. So here's what we're going to do. Let me do a reminder. We're going to have 2 featured speakers tonight. Our school superintendent, Lisette Estrella-Henderson, who does an amazing job. She's been a strong advocate for kids. She got her roots in ESL and Dixon. I remember that, Lisette. And she's just been a great advocate and a supporter of PLTI and kids and families. So, Lisette, thanks so much for joining us. We've asked Lisette to do a 10 or 15-minute overview of where schools stand in terms of reopening. We'd also like to talk to her about the challenges of meeting the needs of vulnerable students, students with disabilities, English language learners, foster and homeless kids. Talk a little bit about the criteria, and we'll also get from the health officer criteria that they're using to look at when schools can reopen. So Lisette, you have the floor. Thank you again.
Well, thank you, Alan, and the PLTI team. Muchísimas gracias a Alan y el equipo de PLTI. I had the privilege of providing one of the sessions early on, and it's just wonderful to see how it has continued to grow. No podré hacer mis comentarios en español porque simplemente no tenemos tiempo. Si lo haría, no podríamos terminar en una hora. So I won't be able to make my comments bilingually because we simply don't have time. But I want for our Spanish-speaking parents to know that we have numerous resources on our website as well. And certainly I'm sure Leo and Alan and Monica Soriano will follow up with our Spanish-speaking community as well. I think that it's important to know that as our schools are concerned, student and staff safety are first and foremost at the forefront of what our superintendents are using to make decisions. With that in mind, how do we teach? How do we reach? And frankly, lift up every student and parent and our educators. We all acknowledge that this whole situation is less than ideal, obviously. And I must tell you, our school districts are making the most of what is at best an untenable situation. In Solano County, as you probably know by now, if you're parents with children in schools, we are starting school with distance learning. And we are seeing educators rise to this challenge and make the best of, as I said, less than ideal circumstances. Our school districts are dedicating all of their back to school activities with their educators to training in terms of distance learning, teaching strategies, and how to effectively use technology to teach a full day of instruction remotely. And they are also learning how to address the social emotional needs that we absolutely cannot forget are critical to engaging students in learning and developing into healthy adults. Very, very important. Certainly is a challenge, and I personally am very, very concerned about that. I would also want to communicate to our parents and our community that what a lot of people forget is that opening schools is not just taking on the academic component of instruction, but it also includes a huge operational component, which includes facilities, scheduling, transportation, and food preparation. Again, something very important. Even when we have distance learning, our schools are going to be having the nutritional available for our parents as well. And then in addition, the huge responsibility is employee safety and wellness as well. All of these components are interconnected and interwoven and complicated. And a huge lift for our school districts and our educators under, again, less than ideal circumstances. I say that because we recognize that our parents, this is going to be a huge lift for our parents as well. Many questions. What about childcare? What if my child is a child with special needs and has an IEP? What if my child is an English learner? What if my family is experiencing homelessness? How am I going to be able to tackle this as a parent? And so just know that our school districts, on top of everything else, they are keenly aware of the needs that parents are experiencing. In Solano County, I know, and I know through my experience with PLTI, that we are a resilient community. We are innovative, and we have a can-do spirit. That is what gives me hope, and that is what gives me the determination that I know that we will get through this. And we have the opportunity to come together as a community to make this happen for our children. In terms of guidance, Alan, there is a lot of guidance that is tried and true based on research and practice, certainly from the Centers for Disease Control. And most of the recommendations and mandates and protocols are coming locally from the California Department of Public Health and the California Department of Education. And certainly we are working very closely with Dr. Bela Matyas and his team at Solano County Public Health. Using these guidance documents as a framework, our superintendents then are working with their locally elected school governing boards. You mentioned that we have some PLTI alumni on school boards. Certainly our employee groups and other stakeholders in our communities to determine their plans, ultimately for in-person instruction, and obviously now for distance learning, and or a combination of the two, which we call a hybrid approach. In terms of the guidance, the criteria that the California Department of Public Health recently posted, reopening in-person learning framework for K-12 schools. So our superintendents are leaning heavily on that as well. In addition, we most recently received guidance on the opportunity to perhaps have waivers to distance learning for elementary schools in those communities that have a specific threshold. And Dr. Matyas is the expert on that, so I will certainly let him address that. So just as a reminder, in terms of the guidance, we do have a robust resource area on the Solano County Office of Education website, solanocoe.net, where we have a myriad of resources for parents in terms of resources, and in addition, this guidance. I think it's important because parents might not realize, you know, where are they coming up with all of these rules and regulations? And it's coming from guidance from either the CDC, the Public Health Department, or our local health department that we've been working very closely with. In terms of what's going to happen at schools, obviously now in distance learning, I want for parents to know that the distance learning that we had last spring is not what you are going to see now. Last spring, we were in emergency mode. And we had to pivot very quickly. We've had a number of months now to plan for robust and equitable education in a distance learning model. What does that mean? It means that there are minimum requirements that children need to be engaged. And I don't want to get this wrong. So for kindergarten, it's 3 hours. For first through third grades, it's close to 4 hours, 3 hours and 50 minutes. In grades 4 through 12, which is our upper elementary to middle school, it's 4 hours. And then up into high school. And then for those young people that are in alternative education settings, such as continuation schools, it's 180 minutes, which is 3 hours. And so that daily live interaction is going to be required now, which was not required in the spring. There was a lot more flexibility in the spring. So I want parents to know that distance learning in this modality now, as we are, is going to be way more robust. The educators are going to be required to take attendance. So we need to have your children be present and accounted for and engaged. As I mentioned, there are going to be minimum requirements to be engaged. We also have the responsibility and the requirement to ensure that parents not only have the devices that they need for their children, but also have the connectivity. And so I would urge parents and have you advocate for your needs. If you don't have the devices that you need or the internet access that you need, school districts now have the resources to invest in getting that taken care of for you. So I think that's very important as well. All of this is also described in the local continuity and attendance plan that each school district is required to have. And so I would also, again, advocate for parents to make sure to reach out to your school district to ensure that, that you're getting your needs met as a parent so that you can be successful. This is a huge lift for parents, and we recognize that, and it's a stressful situation. So make sure that you're getting the support that you need. I will end with English learners, our students with IEPs. These are huge challenges, and we recognize that. For our English learner students that may not be getting the amount of time that they need to develop their English language development skills, especially their oral language proficiency. And how do you do that? It's not only by listening, but it's also by speaking, reading, and writing and interacting with the language. And so all of our school districts have strategies described in this local continuity and attendance plan about how they're going to address that in their local context, whether it be one-on-one through Zoom or small group instruction through Zoom. Or ultimately, wouldn't it be wonderful if we could at least get small groups of students back on campus for this very targeted instruction? The same with the children with IEPs in terms of addressing the goals that are specific to their special needs. It's a huge lift, and we recognize that for many of our children with IEPs, what is most effective is that one-on-one connection and that one-on-one instruction, very targeted and focused instruction. And again, our school districts are required to describe how they're going to address those very specific needs in their learning continuity and attendance plan. That's a broad overview. I was going to say, are you ready to get the hook, Alan? Because I could keep going.
The hook is
that's
coming.
A broad stroke overview, and
no, it's been very good, but the hook is coming soon. So
then I will wrap it up.
Okay, and I'm seriously, Lisette and I go way back, so we can kid each other. But we're going to hear from Bela and our public health officer, and then I see Leo and. Not real good at this, but I see in chat, looks like there's 4 or 5. I actually, Lisette, have about 5 questions, but I'll leave it for another time. All right, so could you wrap it up, and then we'll go to Dr. Matyas.
Yes, so I will just wrap it up and just encourage parents also to take care of your own mental health needs. This is a very stressful situation. And it's important, as they say, to remember to put the oxygen mask on yourself first so that you can then help your child. Remember that your child is picking up cues from you. And so I know it's easier said than done, but remain positive and seek out resources of support. And I do also want to make sure that parents write this number down. It's the crisis hotline. If you or your family member is experiencing severe mental health emergency, call 911 or go to the nearest emergency room or contact the Solano County Mental Health Crisis Stabilization Unit. And the number is 428-1131. And this is 24/7 support. So please seek out the help that you need. Don't feel like you are in this alone. Our educators are here for you, and we desperately, desperately want to be back with your children in school, in person. Please know that. Unfortunately, we are facing this worldwide pandemic and we're making the best of it, but you are not in this alone. I would just urge parents to know that.
Okay, thank you so much, Lisette. I really appreciate it. So now we're gonna hear from Dr. Bela Matyas, who's the public health officer in Solano County. He's gonna talk about data, about criteria, how public health and education is working together. So Bela, you have about 10, 15 minutes and then we'll get into questions. So thank you. Actually, both of you, I can't imagine jobs that are most stressful the two of you are doing now, but really appreciate taking time out of your busy schedule. So Bela, you're on.
Thank you very much, Alan. Here in Solano County, we've been experiencing over the past 8 to 10 weeks a very significant increase in COVID disease. About 10 weeks ago, we were averaging maybe 15 or 20 cases every day. Now we're getting closer to 120 to 140 cases every day. So those numbers have gone up very dramatically. The reason for the change, the reason for the surge is because people changed their behaviors about 2.5 months ago. In March, April, early May, people for the most part were staying at home. They weren't visiting family or friends. They were staying put and they were going out to the grocery store doing what they had to do, but mostly they were staying home. But around Mother's Day and every weekend after, or every weekend since, people have started to get back together with family and friends. And you know, it's interesting, if you ask the average person what's more dangerous, going to the grocery store or going to a clothing store or getting together with family and friends, they're gonna say, oh, going to the store is much more dangerous because I'm gonna meet those strangers who are gonna give me illness. Completely wrong. Your family and your friends are the reason for this outbreak. It's our personal lives and getting together with family and friends that has caused this huge surge, not just in Solano County, but all across the country. And I blame Mother's Day because that's when this started. But, you know, we had big spikes at the Memorial Day, the 4th of July, worried about Labor Day. Interestingly, Father's Day didn't cause a big spike. I don't know what that means, but it didn't. But really, pretty much every weekend since late May has resulted in more and more and more cases. What's happening is that mostly younger people are getting together with family and friends, and when they do, they don't practice social distancing, and that's the problem. Social distancing works. Social distancing is being practiced when we go to the grocery store and to other places. Yes, some people don't wear masks, but for the most part, people are doing the right thing, and we are not seeing outbreaks in the public sector. Where we are seeing outbreaks mostly is in families and among friends who got together for the party, the barbecue, the birthday party, the graduation party. All of those sorts of situations is where these diseases are spreading. And that's where most of the cases are occurring. So unfortunately, we have no way of controlling that. People live their personal lives the way they live their personal lives. And it's up to us to monitor our own activities. Unfortunately, because of the increase in disease, the governor has closed all kinds of businesses, even though those businesses have nothing to do with the increased disease. So that's been hurting our economy more and more. They also made it so that schools can't reopen if we have a high rate of disease, even though schools are not where the spreading has occurred. In fact, you should know that we've already had a couple of hundred positive teachers in our county, and we've had, let me check the number, we've had almost 500 positive children in our county. And obviously they didn't get it at school because school's been closed. And what that means is that all of us are affected by the idea of getting together with family and friends. So let me say, there's nothing wrong with wanting to be with family and friends. We are human, and humans need to interact with one another. The problem is that when we do it with people we know, we're not being careful. So what we have to do is to be careful in those interactions, and that will help control the disease. Because we have such high rates of illness, we also have had an increase in hospitalizations, and we've had a number of people die over the last couple of months as well. We have 41 deaths in our county, and we have roughly 4,500 cases. So our death rate's not high, but those deaths were preventable if people hadn't gotten together in those ways and spread the disease in the party, in the gathering of the family, etc. So those are tragedies we need to keep trying to avoid. The message is that because of the high rate of disease, we are on the county watch list for the state, and we will remain on that list as long as our disease rates remain high. Because we're on the watch list, schools may not reopen for face-to-face education. They may only reopen for distance learning. There is the possibility of exceptions for elementary schools. There is a waiver process that we may qualify for elementary schools, which would allow us to allow at least some of those to have face-to-face, depending on whether they're interested in pursuing the waiver. At this moment in time, I think our hospitalizations are relatively stable. They got up to as high as 55 people hospitalized per day in the county with COVID. It's been running in the high 30s over the last several days. If that trend continues, and if we continue to see the level of positive testing that we've been seeing for the past week or so, there's a good possibility that the state will take us off of the watch list. And that means that schools will be able to reopen for face-to-face or a hybrid of face-to-face with distance. So it is important for schools right now to be thinking about how they will do that. Not only should elementary schools be thinking about what to do for a waiver, but those same basic approaches are going to be used for the higher grade levels reopening also. And really it comes down to what Lisette said, which is we have to be mindful of the safety of our students, our staff, and our faculty. And that can be accomplished. It is possible to have safe environments for teachers and older students. We know that because we have safe environments in other business sectors where we don't see any transmission of disease. So we know that if those things are done right, people will be safe. It's a lot trickier with younger children. Daycares and kindergarten, pre-K, kindergarten, first and second grade are harder environments to protect children. We can still protect the adults in those environments very well, but we need different strategies for children. It has to be it has to be more like what we're doing with daycares than what we can do with older individuals in the school environment. So Lisette and the superintendents are all aware of what it is that they need to do to prepare to reopen for face-to-face. They're working on it. We're working on it with them. I'm actually hopeful that in a few weeks, we might be able to say that schools can reopen. And possibly we won't need to do the waivers for elementary because everything can reopen at about the same time. But that requires everybody in our community to do right by each other. That means that we all have to do what we know we're supposed to do, which is to practice social distancing all the time. I also want to make a point about the phrase social distancing. I think people misinterpret it and they equate social distancing with physical distancing. Social distancing is much more than just physical distancing. Obviously, the best thing to do is to stay far apart from one another, and physical distancing helps prevent the spread of disease. But there are times when you can't stay physically apart, and in those situations, we might need to use physical barriers or we might need to use masks. So we use masks when we can't maintain the physical distancing, and the combination of all the different tools like hand washing, hand sanitizing, cleaning and disinfecting, when you take all of that together, that's social distancing. So a social distancing plan involves many things that protect people from being infected by the disease. Back to you, Alan.
Good, thank you. Thank you so much. Again, I have questions for you, but like Lisette, I'll do it offline.
Okay.
I like people who are participating to be able to ask questions. Leo, are you able to see the questions or through chat?
I just want to put a reminder to everyone that if you have questions, you can unmute yourself or you can post it on the chat section. Also, Monica has been kind enough to volunteer that those of you that are joining by phone and don't want to unmute yourself, you can text her. Monica, I'll let you talk a little bit about that, but let me translate real quick. A todos aquellos que quisieran hacer preguntas, este es el momento para hacerlo. Les quiero recordar que pueden quitarse del mudo o pueden poner las preguntas en la sección de chat. A aquellos que están llamando por teléfono, tenemos a Mónica que nos va a hacer el favor de que le pueden textear las preguntas a ella. Mónica, you want to say something about that?
Yeah, so the people who are joining us by phone, I realize you can't see the chat room, so you can't hear me see all the questions. But if you have a question, by all means, I sent you my cell phone number, so you can text me your questions and I can put them in the chat. Or you can just unmute yourself if you're comfortable doing that and ask your question. We just want to make sure that those who are on the phone and those who are by video get the same information that you guys are getting.
Okay, thank you. And at this time, there's no questions on the chat section, Alan. Anyone that has questions, please feel free to unmute yourself. Para aquellos que tengan preguntas, siéntanse con la libertad de quedarse mudo.
I have a question. Sorry, is it an echo?
Mila, go ahead.
Okay. Well, thank you for putting this on. This is really great. I wanted to ask, is that being that we have a shortage of family home child care providers, I think we lost like 50% of family home child care providers temporarily or permanently due to COVID-19. And family home child care providers are going to have to pick up a lot as far as with school-aged children. A lot of parents are going to be dependent on family home child care providers. What I want to know is there a way to is there a record of anything that shows any reports from family home child care providers of children having COVID, like in their programs or anything? I'm asking that because I feel that there's no economic recovery without family home child care providers. And we want to do all we can here in Solano County to support our family home child care providers and help them open back up. And a lot of them are afraid. A lot of parents are afraid as well. So how can we help families eliminate the fear of the spread of COVID in the child care facilities? Is that clear enough?
It's an excellent question, and unfortunately, the last part of your question is the hardest one to answer. I don't know that there is a way to avoid fear. I think people's fear is real. People perceive this as a very scary disease, and they don't want to be exposed to it. And people know that when children in childcare are together, that they're going to interact with each other in a way that it'll spread the disease. So, the good news, bad news is that the kids themselves are probably not going to get very sick. Very few children have been hospitalized. Even fewer have died all across the country. So this disease, we've had, as I mentioned, like over 500 children in our county. None of them have been hospitalized. So the children are actually very healthy when they're exposed to this. But the problem is they can bring it home. They bring it home to their parents. They bring it home to their grandparents. And so, unfortunately, especially with child care aged children, there's very little you can do to prevent the spread of respiratory disease because it's in the saliva and kids slobber on each other and they slobber on parents, and parents aren't going to not hug their kids. That's just too weird. So that's a real risk that unfortunately we can't eliminate. So what we do in childcare is we try to have the groupings of the kids small enough that if a child does get COVID, they're only going to spread it to the other kids in that group and not to all the kids in the facility. That's not perfect, and it definitely means that small group is going to be exposed. What we can do is protect the adults. I mean, we do have advice to give on how to protect the child care provider, but I don't want to lie and tell you that kids won't spread it and then they won't bring it home, because they will. That's one of the ways this disease spreads. Yeah.
We had a family home child care provider who just closed her business for 2 weeks because one of the children had a fever, but come to find out the mother had COVID and she didn't even tell the provider.
Sadly, that's the most common thing we find. It is actually a lot more common for a parent to give it to a child than a child to give it to an adult. And the kids that have had disease in the childcare environments in our county, they all got it from home. And there's only been one situation where it was spread in the childcare facility, so they didn't even give it to each other very effectively, but they did get it from their parents or their siblings or somebody else at home. there is no perfect answer to your question. It's a great question. And we sort of have to ask ourselves what's more important, complete safety or meeting the needs of children and families in general. And if we go with the second, there's going to be some risk. We have to accept that there's going to be some risk.
Yeah. Okay. Thank you.
Thank you. Good to see you. Lisette,
Thank
anything
you.
else? I'm sorry. Do you want to add anything, Lisette? Okay.
No, I completely agree with Dr. Matyas. And Jamila made a really good point. If we're going to have economic recovery, we need to get parents back to their jobs. And how do we do that without childcare? And Jamila's right. Our family childcare homes are extremely important. In fact, the majority of childcare settings are family childcare homes. We have some actual centers, but our community, our neighbors, family, and friends are going to be and need be our greatest resource in terms of childcare. And Jamila certainly, of all people, has it dialed in. And as Dr. Matyas says, how do we do it safely in a way that minimizes risk? There are not going to be any guarantees. And to think that there are, I think is short-sighted.
Someone asked the chat section that they missed the numbers and spike of disease that Dr. Matyas was providing. Dr. So if you can please repeat the stats briefly again.
Yeah, so right now we are seeing about 120 to 140 positive people every day. 10 weeks ago, it was more like 15 to 20 per day. So it's really gone up tremendously. We've had about 4,500 cases in our county and 41 deaths. So the death rate is gratifyingly low, but the case count is very high, 4,500. And of those, about 5 or 6% are positive, 5 or 6% of the total tests are positive right now, but overall it's about 7%. We've tested about 60,000 people in the county. So the numbers are not big compared to bigger counties, but when you compare it to the size of our population, we're having as much disease as most other counties right now.
Thank you. And that question came from Donna Raquel Johnson, so hopefully that answered the question. If not, please feel free to mute or post it in the chat section. Anyone else? Just a reminder, you can mute yourself to ask questions and put it in the chat section.
I have a question for our special ed kids with IEPs. What is the possibility that our kids who have one-on-ones, that one-on-one is able to help them during this? It would just be one-on-one, it wouldn't be a group. And for our kids that have them, there's a reason they have them, that we can't make up for that.
Yes, that's certainly, thank you, Dottie, for asking that question, a very important question. And it is something that our school district superintendents and our directors of special education are working with the educators, the para-educators, the related services providers to really look at what the specific needs of the students are and how we're going to be able to address those needs. Because again, I'll say this again, Dottie, you've got it dialed in terms of there is no one size fits all approach. And I think that's something that we're really looking at. Will we be able to have the paraeducator do, you know, is it via Zoom? Is it next to the child with a mask and physically distance? You know, one of the things that I really grapple with is that for so many of our children with IEPs, the deciding factor in their success or not is that physical contact, is that social interaction. And how do we do that in this context? And it's something that our, again, our school districts, it's a huge issue that we are really grappling with, because what we want the most is student success, knowing that this situation is obviously far less than ideal. So how do we do that while also addressing the larger school community and you know, the related services? What platform can it be done in? What setting can it be done in? How will the instruction be modified? I think that's also something very important, because what worked one-on-one, face-to-face, doesn't necessarily work via Zoom. And I'm a sibling of an individual who's an adult now, with very significant needs. And I could tell you, I just don't know how successful he would have been under these circumstances. And it's something that is at the forefront, Dottie, of all of our superintendents and our directors of special education, working with the related service providers, teams, really looking at that and how we will address that.
My answer is a lot shorter. It's totally doable by me. I just have to follow social distancing.
There you go.
Okay.
That's
The
why
doctor has
Dr.
spoken.
and I make a good team, I guess.
So we have 15 minutes, Leo and Monica. Good
Thank
question.
you. Someone asked in the chat section, what will the day look like schedule-wise during virtual learning? How often will the children be engaged with the teacher? I have a 3rd and 8th graders at home. This question was from Tamiko Barnes.
Yes, very good question. Well, there are minimum requirements. As I mentioned early on, the requirement for kindergarten is 3 hours. The requirement for grades 1 through 3 is 3 hours and 50 minutes. In grades 4 through 12, upper elementary to high school is 4 hours. And for those young people in alternative education settings, such as continuation high schools, it's 3 hours. What will a day look like will vary depending on the school district and the school. So I urge you, if you have not received that information yet, and it's just beginning to come out, I was noticing, and I've been sharing through my social media resources, as the school districts have begun to publish that information and get it out, you'll be hearing from your school district, you'll be hearing from your school, you'll be hearing from your teacher. It will vary what the day will look like based on the grade level. As you mentioned, you have a third grader and an 8th grader. And also depending on the school district. But there are minimum requirements, and each school district website also has this information posted on their websites. Depending on when school starts, because it's different for every school district, and some school districts have delayed their opening, that information will be readily available. So again, in terms of advocacy, I would urge you, if you have not received that yet, it is coming. And if you haven't received it, obviously before school starts, please reach out to the school district, reach out to the school. That information is now beginning to be posted as the plans are being solidified.
Okay, good. So Leo, we have about 10 minutes, and then we're going to wrap it up. These are great questions, and you know, we are recording this for people that we can't answer every question. So next.
Ramiro, go ahead.
Thank you, Leo. Thank you for doing this meeting. On Monday, I saw on a packet for funding for the county that there was $25,000 allocated for Wi-Fi hotspots throughout our school system. I want to know, one, is that enough? Because I sell electrical parts for a living. It doesn't seem like enough. And has some of this work been done already? Is that why 25,000 is enough to get the job done?
So the first question, Ramiro, that I would ask you is the document where you saw 25,000, because it's a lot more than that. So, each school district is receiving learning loss mitigation funds, LLMF resources. And on the California Department of Education website, it shows the allocation by school district there. So I'm not familiar with the specific number that you are referencing. And those resources can be used to access the Wi-Fi hotspots and the technology devices and the one-to-one devices. The California Department of Education has also entered into an agreement with T-Mobile and Verizon, and looking at getting access to tools that already have internet built into them, so that you don't have to have the device and then buy the internet access. So they have some iPads, and those are being obviously distributed across the state, those resources. So I'm not familiar with the $25,000 specific amount that you referenced, but that obviously, yes, you are right, would not be enough. Maybe for one school, maybe, but certainly not a whole school district. So the learning loss mitigation funds have been allocated across the state and in every school district and county office of education, and the California Department of Education does have those resources, that whole list in there.
Okay, Leo, can we go to the next question? Now, these are all great questions, by the way.
At this time, I don't see questions in the chat section. Members of the audience have any questions, please reminder to unmute yourself or post it in the chat section.
So Leo, I'll take the prerogative. Lisette, I've heard a lot about food insecurity in terms of schools for kids who aren't there. It's such a big issue. What's happening, as far as you know, in Solano to make sure that kids who deserve healthy meals are getting it?
Yes, absolutely. So very similar to what we did last spring, the school districts are going to be providing meals even though we are on distance learning. So they'll have information about the locations and the sites and how to access those resources. Absolutely.
Okay, big issue. Thank you.
Yes.
Leo or Monica, other questions?
I don't have any questions, but I just want to tell you both that thank you so much for making the time to speak to our parents. I know that all of this is challenging. I have two little ones, and all the uncertainty is sometimes really, really overwhelming. I can only imagine how they feel. So I appreciate that you guys are taking the time to talk to our parents and to just really be transparent, because I think some of the overwhelming feeling and anxiety comes from just not knowing and being overwhelmed by all the media that we see on TV, on Facebook, and so on and so forth. So I just really appreciate you guys taking the time to just, listen and just explain things. And we don't know the answers, but it just helps to really hear that there are people that are working in the background, and we're just going to try to figure out as we go along, which is, I think, what all of the parents are just really trying to do. So thank you again for making time. I really appreciate it.
Monica, you are so welcome. And I would say to our parents, I am in awe of you. You have been thrown into this situation. You didn't ask for this situation, right? As educators or as doctors, that's what we choose to do. And but you've been thrown into a very tough situation, and I have just been so impressed by the parents, and yet recognize how very stressful this is. And so I would urge you again, reach out for help. If I could give you one piece of advice, breathe, and know that our educators are so desperately wanting to see your children in person again. And it's going to take the entire community, as Dr. Matyas has described. We all have a hand in helping our schools and our businesses reopen. So it's going to take all of us. Know that the school districts have resources available to you. Please don't be afraid to ask. As a PLTI advocate for you, don't be afraid to ask. Know that people want to help you, they want to support you, and we are all going to make mistakes during this entire process, right? It is not perfect, but our schools want to see your children, they want to see your children succeed, and we want to help you as parents with the tools that you need. So please reach out to us. If you're not hearing from the school district or the principal or the teacher, it's okay, and it's important, and it's your responsibility. I urge you, reach out. If you're having trouble, don't be afraid to ask.
Thank you, Lisette. And I do second Monica's comments for you being such a great advocate for families, for students, being accessible. We talked, you and I, a few weeks ago. It's so important for parents to get information so they can share with others. So we really appreciate all your wonderful support. And Dr. Matyas, again, thank you for all the information you provided. We have recorded this, so we'll get this out to people that weren't able to ask questions. For PLTI, we hope to do more of these town halls because this is front and center, Lisette, as you know, with parents. Monica started off in the spring talking about concerns she had with another school district, and then it just kind of took off. So this is not going to go away, but information is power, and we appreciate you sharing that. Dr. Matyas, any last words? We're doing great. We have 3 minutes.
No, I'm good. I appreciate the invitation. Thank you.
Okay, thank you very much. We appreciate it. So I want to acknowledge my colleagues, Leo Callejas and Monica Soriano, who are amazing, keep the PLTI going on a shoestring budget. So if you're interested in knowing more about PLTI, contact one of us. We'd like to bring it back to the community. So Leo, any last thoughts?
No, Alan, thank you. I appreciate everyone's time. And yeah, we will be posting this on Facebook. So if you have, if you want to provide the recorder, if you have follow-up questions, please feel free to contact us.
Okay, great. All right, thank you, everybody.
Thank you for the invitation.
Okay, bye-bye.